right, welcome again to everyone. It's my pleasure to welcome you today to our webinar. This is part of the RNC's Accelerating Collaborative Team Science webinar series. So I will be your host today. My name is Dr. Julie Horvath, and I work at RNC, the Renaissance Computing Institute at UNC Chapel Hill. And I also work on the NIH Helping to End Addiction Long-Term, or HEAL project, which you're going to hear more about today. And I work with large teams conducting participatory science research. And so my research includes a lot of team science collaborations. And I hope you're going to hear a lot more about some of these larger collaborations today. So today we have Dr. Heather Barnes and Mary Hannah Marshall from RTI International, as well as Brandy Farlow from RNC. And they're going to be joining us today to lead our discussion. So I'm excited to introduce our panelists to you. And first, I want to highlight a couple of housekeeping items before we begin. So there's a quick overview of our agenda, I believe on the next slide, and we're going to take a moment to just introduce our guest speakers and then hear more about what our work is that we're working on today. And then we're going to spend time learning about the panel during this presentation, and then we're going to jump to conversations that are going to be prompted from some that you already uploaded and some you can add during our presentation today. So we've disabled Zoom Q&A for attendees. We have some comments in the chat bar. If you're here on Zoom, you can look at the chat. That'll give you some links to some of the Easy Retro and other places that we'd like you to go. All questions that are related to the panel, please, we ask you to upload those to that Easy Retro board, which is our crowdsourcing Q&A platform. And that'll just keep all our questions there, and then you can upvote and add comments. So it'll be a really great way to have interaction from all of our webinar attendees. So I believe we just have the Easy Retro that just appeared in the chat again, too. So hopefully you're going to find the Easy Retro platform intuitive. It's pretty easy to use. And so we welcome you to add questions and comments throughout the presentation today. But at the end, we're going to share more instructions and the link after the discussion so that we'll walk you through if you have any questions on that. So without further delay, let's meet our guests today, who are our panelists. So I'd like to welcome Dr. Heather Barnes and Mary Hannah Marshall from RTI International and Brandy Farlow from RNC. Dr. Heather Barnes currently works with the HEAL Data Stewards Group as a data curation subject matter expert, or SME. So in addition to her role at RTI International, her professional background includes serving as a digital curation librarian at the Z. Smith Reynolds Library at Wake Forest University. She earned her MS degree in library science and her PhD in information science from UNC Chapel Hill's School of Information and Library Science, or SILS. And Mary Hannah Marshall is a research data analyst in the Center for Data Modernization Solutions at RTI International. And she works on a number of NIH-funded projects, so she assists with data sharing and management efforts. And she's a certified data management professional and holds an ALA-accredited degree in information science from UNC Chapel Hill. And Brandy Farlow is a research proposal and documentation specialist at RNC and UNC Chapel Hill. She works as a member of the HEAL Data Stewardship Group, and she also helps organize a lot of the team science events. So I'm sure you've seen her at some of our ACTS webinars before if you've attended. She also helps with team science activities across RNC. So she's hoping to better understand the science of team science through these efforts. She holds a bachelor's degree in English, a master's in mathematics education, and she's pursuing a PhD in leadership, focusing on leadership in science collaborations. All right, so now that I've introduced our panelists, let's take a look at how we define team science. So I believe that's going to be on our next slide, I hope. So many folks are going to use this definition from the National Cancer Institute. And so we define team science as a collaborative effort to address a scientific challenge that leverages the strengths and expertise of professionals, oftentimes that are trained in different fields. And although traditional single investigator-driven approaches are ideal for many scientific endeavors, coordinated teams of investigators with diverse skills and knowledge may be especially helpful for tackling complex scientific and societal problems. So this is going to be our mantra going forward, really diving into team science. And so now let's dig into our presentation today. It's fostering a data sharing culture in collaborative team science with insights from the NIH HEAL Data Ecosystem. And I'm going to hand this off to Brandy Farlow to start our presentation today. So take it away.
Wonderful. Thank you, Julie. So today's research landscape is kind of complex, and fostering a culture of data sharing is essential for advancing team science. But discussions around data sharing are often very challenging. So today we're going to explore how shifting from a competitive mindset to one of collaboration can unlock new opportunities for innovation and discovery, highlighting the benefits of open data sharing in the team science landscape. Drawing on insights from the NIH HEAL Data Ecosystem, we'll discuss strategies to break down these barriers and cultivate a supportive environment for researchers and stakeholders alike. Slide. So now let's take a look at what we'll cover. So first, we'll discuss how open data sharing enables collaborative team science. We'll explore the essential role that open data sharing plays in fostering partnerships and integrating diverse expertise to address complex research challenges. And next, we'll introduce the NIH HEAL Data Ecosystem, which is a crucial initiative aimed at enhancing data sharing practices across the science community to address the national opioid crisis. We'll then dive into data sharing barriers that many researchers face. Understanding these challenges is vital for developing effective strategies to overcome them. Following that, we'll highlight the benefits of data sharing, including enhanced research discoverability, validation of findings, and increased public trust in science. These benefits are pivotal in promoting a culture of collaboration. Finally, we'll wrap up with an overview of the HEAL Data Stewardship Group's programs and resources. These initiatives are designed to support researchers in their data sharing efforts, providing tools and guidance that foster a thriving and collaborative data sharing culture. Slide. So let's talk about open data sharing. This concept is more than just making data available. It encompasses three considerations: transparency, sharing, and inclusivity. First, transparency enhances research visibility, making it easier for researchers to understand and use studies effectively. This also promotes accountability by highlighting funders and potential conflicts of interest that could impact results. Sharing involves making data and experiments accessible and reproducible, always adhering to ethical standards. Providing comprehensive documentation helps ensure that others can build on our work or just find us for their collaborations and for deeper discussions that further our research and science. Finally, inclusivity ensures proper credit for all contributors and involves and acknowledges the impacts on involved communities. When we prioritize these elements, we create a collaborative environment, build trust, and that is all the foundation for team science. Slide. So open data sharing benefits the scientific community in many ways. It enhances research discoverability, enabling researchers to easily locate relevant studies and data sets. This increased visibility builds public and researcher trust in our science, as transparency fosters confidence in our findings. Moreover, open data sharing supports validation of research results, allowing teams to verify and replicate studies, which is essential for scientific inquiry. Additionally, it facilitates capacity building by empowering teams to share knowledge and resources, ultimately strengthening our collective expertise. These contribute to a more interconnected research community where collaboration is not just encouraged, but is a foundation of our scientific endeavors. Slide. That said, open data sharing specifically promotes team science by making data readily available. By doing this, we enhance efficiency, allowing researchers to build on existing work rather than starting from scratch. This collective knowledge sharing actually accelerates discovery and innovation. It also makes it easier to identify potential collaborators. When researchers can access shared data sets, they can connect with others who have complementary skills, ideas, and interests, leading to more fruitful partnerships. Further, it paves the way to more integrative approaches to solving complex problems. In team science, diverse perspectives are crucial for tackling multifaceted challenges. Open data creates a foundation for cross-disciplinary collaboration, enabling teams to pool their expertise and address issues more holistically. That's something the HEAL Data Stewards ecosystem really promotes as foundational to broaching the complexities of the opioid crisis. Slide. Ultimately, open data sharing represents a significant win for both science and collaboration. By breaking down access barriers and enabling more collaborative, transparent, and inclusive research, open data sharing plays a key role in advancing team science. This approach allows us to integrate diverse perspectives and expertise into our research. Again, as a result, we can more effectively identify potential collaborators, increase public trust in our findings, drive innovation, and enhance research impacts. In essence, open data sharing amplifies the power of team science, allowing us to leverage our collective knowledge and skills to push the boundaries of what is possible in research. Slide, please. Okay, so what's the problem and what can we do? Well, we have to acknowledge that data sharing is not without its challenges. Many researchers have very legitimate concerns about open data sharing, and we'll discuss those shortly. This complexity is why initiatives like the HEAL Data Stewards are so crucial. They aim to address these concerns by creating a supportive data sharing ecosystem that benefits everyone, from patients to researchers and beyond. So now I'd like to turn it over to Heather, who is going to elaborate on how our project is effectively addressing these challenges and fostering an environment conducive to team science. So Heather, go ahead.
Okay. All right, so the NIH HEAL initiative is a collaborative effort that supports research on pain and opioid use disorders. The HEAL Data Ecosystem provides the infrastructure for the HEAL initiative's data management and sharing strategy by coordinating primary tools and support teams. Those tools include the HEAL Data Platform and HEAL Semantic Search. And the support teams include the HEAL Data Stewardship Group that Brandy mentioned and the HEAL Data Platform team. So these partners work together to help investigators make their data fair, findable, accessible, interoperable, and reusable so that they can meet the HEAL data sharing compliance requirements. They work together to develop the HEAL Data Platform so that researchers can discover and compute with HEAL data sets. And they also work together on HEAL Semantic Search so that researchers can explore the conceptual knowledge, the synonyms across data sets, relationships between different types of research. Next slide. So this just sort of gives us a visual overview of the HEAL Data Ecosystem. The HEAL Data Platform on the right is a search and discovery interface that's powered by metadata and secure cloud-based workspaces. Rather than storing the data locally, the platform interoperates with individual repositories in which HEAL datasets are deposited by researchers. The HEAL Semantic Search, as I mentioned, provides a way to explore the knowledge that is represented in the system, synonyms, relationships, intersections across HEAL research. And then the HEAL Data Stewards that we've been talking about, they provide customized guidance for researchers in terms of helping them select repositories, helping them navigate the data submission, data sharing process, how to do metadata, and we provide all kinds of resources to support investigators. Next slide. So one of the primary goals of the HDE, HEAL Data Ecosystem, is to foster a collaborative data sharing culture. The HEAL researchers that the data stewards support typically face a lot of the common barriers to data sharing that we'll talk about. So we started to do sort of a landscape review, a landscape analysis, in part to help drive efforts to improve, sort of meet researchers where they are, figure out what their current capacity is for data sharing and help them meet their goals. Next slide. So our initial effort was a literature review, landscape analysis, specifically focusing on data sharing behaviors, barriers, and incentives. Common factors that, according to the research, tend to help either encourage data sharing or inhibit data sharing. Our first effort was to develop a poster for the annual HEAL PI meeting. We also created an online resource that is a persistent resource for folks to look at. And then we developed a case study, which is in a journal submission process currently. Next slide. So we'll talk a little bit today about what the literature has to say about typical barriers to data sharing. As a small writing group, we reviewed dozens of research articles that featured findings specifically about data sharing inhibitors, and the factors that tend to surface most often include things like the fear of scooping, a lack of funding, training, and support, the difficult and complex costs of anticipating or working through data sharing, concerns that researchers have about sensitive data, privacy, concerns about receiving credit for their work and career progression, and then other publication-related barriers. So we'll talk a little bit about each of these in more detail. Next slide. So many researchers fear being scooped, which means that they fear losing out on career publication options based on their findings. if they openly share data before a publication. According to the research, we found that this factor tended to vary between disciplines. Some domains tend to be a little bit more collaborative in nature, whereas others focus more on individual contributions. So we recognize the importance of not generalizing across all scientific disciplines, but this particular fear was mentioned in quite a few articles. Next slide. Another barrier, sharing data requires some support and funding, and well-resourced, funding-rich institutions are much better equipped to help their investigators navigate the costs and budgets. Lower resourced institutions might have researchers that don't have access to training, funding, infrastructure for sharing data. Some of this relates to the existence of data services units in the libraries at institutions, and other sort of differentials between well-resourced and low-resourced institutions. Next slide. Another frequently mentioned concern in the literature we reviewed was around sharing sensitive data and the need to protect participant privacy. So at Echo that we often hear this concern from HEAL-funded investigators. We have frequent conversations about what types of data, what data is feasible to share, even if sensitivity concerns prevent sharing all of the data from a study. Next slide. And then another frequently mentioned concern is lack of recognition for data set publication. And we realize from the literature and from other readings that we've done that this issue could be shifting in some domains. However, a lot of the current research indicates that it's been a barrier. Acknowledging data set publication as part of tenure and renewal packages is something that, if expanded, it could really help support researchers' choice to share their data openly. And then next slide. So now we'll go into some of the factors that we identified that support and incentivize data sharing, and Mary Hannah will share those.
Thanks, Heather. So for this next section, I'm going to be going over researcher-supported benefits to data sharing, and this is just an overview of some of the major benefits that I'll be reviewing today. Next slide, please. So these conditions that promote data sharing is a broad summary of the benefits of data sharing that were highlighted in the literature. So some of the major focus areas are open research culture, opportunities for career advancement and citations, which I know Heather also mentioned as a barrier. So we'll talk about that a bit. And research access, efficiency, and impacts. And you'll see these major focus areas sort of throughout the benefits that we're going to be talking about. So there's also a lot of common themes that popped up in the literature, including the need to support open science rather than competition. Data sharing also supports career advancement and helps provide research credit, and increases things like research impact by optimizing publications and citation opportunities. Next slide, please. So one of the benefits of data sharing is fostering a culture of open science. And this really helps to improve things like access to data by encouraging data sharing, as well as publications and other research projects generated by these publicly funded studies. So I think open science also goes hand in hand with a lot of the different initiatives that we've seen and talked about with the HEAL project, like making data fair, which is findable, accessible, interoperable, and reusable. Next slide, please. So in the spirit of making data reusable, another benefit of data sharing is positive impacts on public health. So that broad access to data and research helps to improve health outcomes by expanding knowledge about different public health problems and also solutions to those problems. And I know this also helps in areas like different, infectious disease outbreaks, monitoring and things like that. So having data sharing that's efficient and quick can help in those situations. Next slide, please. So increase in citations is also a really interesting metric that came up in the literature, and I like that this had an actual percentage. So research actually indicated that making these data sets available in conjunction with your publication can actually boost your citation counts up to 25%. And again, this further improves the impact and reach of your research. Next slide, please. And you'll start to notice that a lot of these benefits go hand in hand and connect back to some of those major focus areas that I mentioned before. So this benefit is productivity, reputation, and career advancement. And sharing data has shown to expand opportunities to have your data sets reused and cited by other publications. And the resulting impacts of those publications can help support a case for promotion and also show that you're a team player, think in the area of open research. And it's also worth noting that different fields may vary in their recognition of dataset publication as well. Next slide, please. And this final benefit goes back to the idea of reuse again, which is reciprocal access to open data. So an open data sharing culture supports reuse and helps to ensure that researchers can find and use data that may be of benefit to them. And one caveat to this is that there is adequate awareness of sensitive data needs as well. Next slide, please. So this slide shows a list of the HEAL Stewards program resources that were developed to help support data sharing in the HEAL project. And many of these were developed by the HEAL Stewards team that Heather mentioned before. And they're listed in three main categories here. And this is just a small subset of some of the resources that have been created. So the three main categories are presentations and outreach, and we have an annual meeting where we're able to interact with some of the researchers. We also have an ongoing Fresh Fair webinar series where we take topics like data sharing and create some useful and timely guidance and resources sort of as researchers are having challenges. We also provide one-on-one consultations with the HEAL researchers and have developed other reference resources that they can refer back to, like the repository selection guide listed here. And stewards have also developed different tools and trackers where available to researchers, where one example would be the PI checklist tracker. So that tracks the progress of registering within the HEAL platform and sharing their data within the HEAL ecosystem. So that helps keep them on track for those data sharing requirements and efforts. Next slide, please. So these are some additional resources, and this is sort of a summary resource that we created based on that paper that we wrote that's linked here that you're welcome to review. There's also the URL listed for the HEAL Stewards website, and a lot of those resources that I just went over are all available on that website if you would like to review some of those. I know they're specific to HEAL, but I think also could be very applicable to other research programs. And at this point, I will pass it back to Julie.
Thank you. All right. Well, thank you very much to our panelists so far, to Dr. Heather Barnes, Mary Hannah Kieran, and Brandy Farlow for a great conversation. So we'd like to hear from all of you so we can move to the question and answer period. So I saw some of you are actually going in that easy retro already. So we really want to hear some of your questions. We have some already populated in there, but really add in your questions, upvote if you have it, and we'll talk about that in just a minute. So if you can go to the next slide, I'm going to talk a little bit about Easy Retro how-to. So if you go into the Easy Retro board, you can just click on the plus sign in the relevant column. So there are multiple columns talking about some different topics. And then you can type in your question or idea. And then when you're finished, just hit the blue box with a thin white check mark, and that'll save within that field. And so then it'll show up on the screen for everyone else. And then you can also go in and upvote. So if you like a question and you really like to hear that, I'm going to focus on starting with the questions that have the most votes. So if we don't get to everything, we'll certainly try to get as far as we can, but we're definitely going to focus on the ones that have more upvotes. So if there's something you really want to hear about, please go and upvote it. If you have a comment you'd like to add, please go ahead and add in some of your comments. And so I think we can probably go over to the Easy Retro board now. And we can start looking at some of those questions, and then we'll ask our panelists to address some of them. All right. So the Easy Retro link is in the chat if you don't have it, but we're going to show it here. So hopefully you can read what we're showing. And like I said, I'm going to read the questions and then the panelists can go ahead and answer some of those. So first question with lots of votes here. How does one overcome privacy concerns and de-identification costs in collaboration? So vulnerable populations like this, for example. So I'll let our panelists take that away.
Well, a couple of the strategies that the HEAL data stewards have adopted include, we have a data de-identification specialist in our group who can work specifically with researchers who have these types of questions. The structure that we have is that if research teams are concerned about sharing sensitive data, they can get in touch with us and we can set up a sort of one-to-one consultation with them to work through all of their concerns. And quite often we've found that even if they can't share all of their data or there's significant chunks of their data that have to be sort of embargoed, or we need to make arrangements with the data repository to restrict access to some of the data, that there's usually some elements of the study that we can have them share, like the study level metadata. We can share information about the variables that they're using to collect the data. There's a lot of sort of information that underlies their publication that's possible to share. And a lot of other folks chime in on this as well.
I think you covered that one pretty well. So.
Yeah.
All right, thanks. Okay, let's move on to another question. So can you guys answer what are some common concerns or hesitations that contribute to inhibiting data sharing? So maybe legal barriers, if any, that might inhibit data sharing. If you could speak to that, that'd be great.
Well, the ones that we sort of identified from the literature, which, this is based on scholars who have been interested in trying to figure out why data sharing has been experiencing so much hesitancy. So as we sort of covered in the slides, and we'll share those afterwards. But some of the things that have come up most commonly include that sort of fear of being scooped. So, the need to retain credit for publications and for the research work that folks have done, and not release it too soon, right? So that they get all of the benefits that they can out of having multiple publications, opportunities to share their information and sort of receive career credit for that. So that's kind of a big one. We also found that there are a lot of researchers who work for institutions where they don't have a lot of support yet from research data services, and that's a really big area for growth, right? So ensuring that everybody has access to, a data services librarian or other folks who can help support them in navigating the submission process. I know in the HEAL work we do, we get a lot of questions about what are the first steps in approaching a data repository? How do we sort of navigate that complicated process? And we can help with that, but not all researchers have access to that type of support. We talked about sensitive data, and then sort of the fears about lack of recognition for data set publication and the need to expand opportunities for folks to include data set publication in their tenure and renewal packages, right? So culturally, it's not accepted across the board, but it's starting to inch in that direction. So.
Well, I definitely think there's oops, sorry.
Yeah, I was going to say, go ahead.
I definitely think there's a lot of benefits to making sure people understand these benefits, really emphasizing those, because the drawbacks are real and they are very legitimate concerns that people have. But the more we emphasize this idea of secondary research and furthering what we can learn, and the more we further this idea that it can really benefit the researcher as a scientist, I think the better off we're able to really encourage that.
I've also heard some concerns, I think, in some of the work that I've done with lack of control over how the data is going to be used by someone else. And things like that, I think we can work to foster this culture of open research and trust, but also provide understanding by providing options like access controls and things like that, and thinking about other ways of sharing data that might be more responsible for that particular group, like Heather mentioned, with sensitive data concerns. So it's definitely, you know, unique to the researcher, unique to the area, unique to their financial situation. And I think that is what's so helpful with the consultations and having one-on-one discussions with researchers, is that we're able to kind of cater to their specific needs.
Great, thank you. All right, so just as a reminder, if you guys want to, in the webinar, want to ask additional questions, please type in your questions in that easy retro board. And please also upvote if there are any questions that you're interested in hearing about. And after we answer questions, we're moving them over to that brown right column where we are answering questions. So you can see which ones we've already answered. So next question for our panelists. It's going to kind of relate to something that Mary Hannah was talking about. So this is related to the question on tracking success. Does the HEAL project track data reuse?
So I'm thinking this means, are we tracking like downloads of data sets? And to be honest with you, I'm not sure. I believe that the platform, the HEAL platform, which stores the metadata, have some metrics in place around tracking the number of downloads. But beyond that, it's a little bit harder to track where that sort of data set goes for the rest of its reuse life cycle, right? So we have a little bit less of an ability to find out if other researchers have been using the data sets to create new publications. But I think hopefully that's something that we can address at some point.
And I think at the conference, I did get to meet a few people that specifically do research on sort of secondary data use within the context of public health research. So I'm not sure about how they will be using the HEAL published data down the road, but it does seem like there are people within the network that do that type of research. So hopefully we'll be able to kind of talk with them and track it down the road as well.
Yeah, and just to add on to that, there is an organization called DataCite that is working to develop data citation metrics so that we can more easily track data sets. Once every data set has a DOI, has a persistent identifier, then it's a little bit more easily able to be tracked. But it's part of the problem is like integrating our systems with these sort of broader systems that are in development.
Thanks. Looks like we have a question that kind of relates to this, so I'm going to hop to that one. So related to the data use tracking, do you issue DOIs for the data and or the tracking data citations?
So yes and no. So if as Julie knows, this is super complicated. Let's see if I can think about this way. Yes, we do provide DOIs for material that's embedded in the platform, right? So if it's ingested into the platform, we do have a DOI for that. Beyond that, when researchers publish an article, they can indicate that they have deposited the data into a repository. And for that, they typically get a DOI. So there might be multiple DOIs for a given data set. And it really depends. It depends on what the journal requires. It depends on how the researcher has sort of navigated that publication workflow. But there is definitely the opportunity to obtain DOIs for our data set once it's published. I don't know if you want to add anything, Julie, because I know you work really closely with.
Yeah, I work a lot with the publication group, so not so much the DOI angle, but looking at the data reuse. I certainly have thought about that a lot, and we do find data reuse, but it's more often if there's another HEAL researcher using a previous data set, and then they link in their funding statement in a publication, hey, here's a HEAL-funded publication, then we find it, and then we see, oh, that they used a previous data set. So the tracking piece is really challenging because not everybody tracks data and funding sources the same. And so that is definitely a challenge for HEAL, but I think all across the research community, that is definitely a big challenge. Yeah. All right, so I'm going to go to another question that got another upvote. So that's under the green section here. So one of the challenges in multidisciplinary teams is fostering cross-team understanding, that is distributed cognition. So what has been your experience with the role that data sharing and interoperability can play in supporting cross-team understanding? So think data as a boundary object, maybe. I don't know who wants to tackle that, but...
I do think that's one of the challenges, right? We collect a lot of data through the HEAL ecosystem, trying to make sure that people are sharing and incorporating these ideas is tough. Through a lot of our webinars, we do a lot to try and connect. We do a lot to build a research community, right? Where people can connect their ideas or at least find people that they can collaborate with beyond just the data. I think that lends towards that. I think there's a lot of work to be done here still, though.
Very fair. Heather or Mary Hannah, do you want to add anything to that?
I guess what I think about in terms of, cross-team understanding is the role that common data elements. So for teams that are using the same types of variables, labeling them the same, there's more of an opportunity to bring that sort of cross-team understanding. So we do some work around fostering and encouraging people to use common data elements. Every field is in their own state of evolution around, whether and how extensively they use common variables, common concepts, to both do the research and then to be able to join data sets once they're completed. So I would say that's still an evolution, but there's a lot of effort on the part of NIH to sort of implement and encourage the use of those common concepts.
Thanks. All right, let's switch to one of the orange topics here. So can you guys comment on if it's possible, and if so, how can you change the mentality of competition to a mentality of collaboration? So this team science approach, how do we get more into that realm in an environment that promotes individual success currently?
I mean, I think part of it is providing those incentives, right? So, we want to encourage people to reuse data. I think that's the bare minimum, right? So that making your data set available to others enables you to also have access to data when you need it, right? So you may want to design a study that benefits from the data, the open data that other people have published. So that sort of interchange of resources supporting rather than sort of being as protective, I think is a good first start. No other folks have thoughts about that?
I think policy also helps, or at least provides us a leg up. I know, NIH has changed their data sharing policies more recently. We've seen a lot of other federal groups doing the same, where they're either strongly encouraging or requiring data sharing, the creation of data management and sharing plans. So having some of that policy in place to help support this and make it a requirement so that people are more actively seeking out help and consultations, I think definitely helps. But it is a challenge to change mindsets, especially around things like collaboration and, like is mentioned here, something that promotes individual success currently.
I'd say too.
I wouldn't. Sorry, Brady. Go ahead.
No, go ahead, please.
I just don't want to understate the need for resources, right? So that was really a common refrain in the literature, is that it costs money to share data, and it requires skills and expertise. It requires someone who's sort of adept at data management. So providing those resources and making sure, what a lot of institutions are doing are creating data services units that can jump in and help researchers navigate a lot of these barriers. And I think that goes a long way towards fostering the environment in which everybody can succeed in data management.
One of the things to think about is really creating this idea of a shared purpose, which is pretty foundational to team science. But in HEAL, I mean, we're working to collectively address the opioid crisis. If nothing else is enough to make you want to collaborate in this environment, this idea that we're trying to solve something that is a foundational need in this country, right? It is a huge problem and it's something that really needs addressed, can really encourage people towards wanting to share, because we're working towards something that is vitally important. So really just encouraging people to share that sense of purpose is very helpful.
Thanks. Well, there's still some great questions back here, and I think some of them touched on what you've already addressed a little bit, but I think I'll go to the middle one here. So I'm always interested in new ways to measure if teams are on track or successful in these areas. Do you have any thoughts about maybe measuring and tracking team success?
I think from a resource perspective, I mentioned the PI tracker that was created by HEAL. And I know they're going to distribute links later, but I'll just paste it in the chat. This was originally called a roadmap and went through sort of the different stages of data sharing and registration. And researchers are able to type in their project number and see which items they have achieved. And I know I'm on at least one other project that does a similar thing with key performance indicators for their researchers, and that's how they're going to be tracking their data sharing progress. So I think this is maybe going to become more common, especially now that it's a requirement from NIH to have the data sharing piece for many of these research consortiums. And so from a logistics perspective, I do think having resources like this, even though they do take a lot of time to create, can be very, very helpful in visualizing that for the researcher and kind of seeing where they are in that process.
I would mention too that the NIH National Eye Institute is launching a new challenge to promote data sharing. So they want to create whole cloth a new incentive for data sharing called the S Index. So we'll see if this takes off. They're still accepting sort of applications for this challenge, but what they're trying to do is to create a standardized metric called the S Index that will assess how effectively researchers share data. So you can see that, just the fact that they're putting some effort behind this, they want new ideas. They want people to think about how can we encourage and incentivize researchers to share their data. And they're trying to sort of gather some of the best, most innovative ideas around that. So hopefully that will sort of make an impact. I'm excited to see what happens with it.
I've also heard some about ORCID IDs as well being used. So making sure that you connect your ORCID ID to your publications, to your data sets to make sure that all of that is in place prior to those being used to kind of track your progress and data sharing.
Great points. And I think I'm going to go to the next question that kind of ties into that. So if you were going to point others to one resource that might help them apply some of these team science ideas to their own teams, what might it be? So probably you've given a lot of resources for HEAL specifically. Do you have any broader team science resources that you know of you can provide? And if not, we can always send it out in an email afterward too.
I would say, a good place to start is the NIH guidance, right? So when researchers are initiating, it's really helpful to think about data sharing when you start a study instead of at the end, because there are a lot of things that you need to think about when you're doing your data collection. Am I using common data elements? Am I sort of following best practice? What do I need to put in my data management and sharing plan, which is submitted at the time of grant application? So I really always like to encourage people to start early and to really think about what they'll do with their data long term when they're designing and applying for money, for funding for their project. It's good to have a plan. Another really good resource is the folks who work at the DMP tool, which is a free online resource for folks to generate data management and sharing plans. There's been a lot of work around making those plans machine actionable so that they're already ready to go. They can be tracked long term. They're sort of automatically generated. You can save them. You can do a lot of things with those. So that organization, that group has been doing a lot of work to make it easier to approach data management and sharing planning at the outset of research studies.
Great point, thanks. All right, let's get a little bit more specific on the NIH. So as the NIH makes more data, what tips can you provide for navigating some of the database systems? Because this person says that I've struggled to find some variables, et cetera. So do you have any helpful tips for navigating database systems?
I'm not sure if the question is related to common data elements or related to repository databases.
I was thinking the repository databases, but I think CDEs might come into play.
Yeah, and it sort of depends on if you're a researcher and you're trying to design a study wanting to use common data elements. The NIH maintains a database of common data elements that are specific to research domains. So you want to sort of narrow down what area of research you're looking at, and then it'll sort of filter through. That's a good place to start. In terms of repositories, unfortunately, repositories are all very different. Some of them are a little bit more, they have a little bit more usability and ease of navigation than others. But I would say, in this case, if you're doing a search for data that's reusable, if that's sort of the goal, I would definitely, not to be, I'm a little bit biased, but definitely connect with your local data services unit or research librarian to kind of help construct a bibliographic search that addresses all of the data sets, because there are some new tools that are coming online to help make it easier to find data sets that can search across repositories. So I'll have to grab the link, but there's a couple of good sites where you can actually do searches across repositories. I'll share that in the chat.
Great, thanks. Yeah, there's a lot of great links in the chat, so we can send some of those out after the fact. But if you guys are in the chat right now and can grab those, there's some really great links popping up in there. So our last question for today, I think, because then we're going to be out of time probably. So I think this will kind of be a good place to end us and lead us into some of the topics that you've already talked about, but just getting people to think forward a little bit. So what would you have investigators think about during proposal development? For example, are there crucial conversations that should happen at the proposal planning stage earlier than when they've actually implemented their study? So what would you recommend researchers and investigators think about when they're developing their proposal to try and think through what they're going to need at the back end to get their data reusable and fair?
Yeah, this is a great question. So when you're starting your project, you want to think about the type of data that you're collecting, the file formats that you'll be collecting it in. You want to start to think about ideal repositories for your work that might be either domain specific. There are a lot of repositories out there, and it can be kind of a bit of a process to think about what's the most appropriate repository for your data. The HEAL stewards we actually have a repository selection tool to help people think about which one might be most appropriate. And to that end, NIH has definitely been interested in sort of promoting or allowing folks to use the repositories that are, have some persistence behind them. They have good funding, they've sort of been vetted. So it's really helpful to check to see what your field requires in terms of data preservation. I know there's some other folks. I'll let Mary Hannah and Randy weigh in if they want to.
No, I think definitely, like Heather mentioned, a lot of the items that are going to be in your data management and sharing plans, since those are now due sort of at the point of proposal earlier on in the process. Again, data management and sharing plans are meant to be revisited and iterated on as things change. So you might not have to have all of the answers, but having some of those resources to go ahead and look through, make it a lot easier. It makes it easier for us too, if the data management and sharing plans are filled out more fully, because we can get a better idea of the types of data that you'll be collecting. And the DMP tool resource that Heather mentioned also has example data management and sharing plans, and ones that people have generated on there. So sometimes it's nice to go through. You may be able to find a data management and sharing plan that is a similar research area to get an idea of what those look like for different research projects.
And then I'd also just reiterate, as far as crucial conversations, making sure to have conversations about sensitive data and specific sensitive populations that you will be collecting data from, who needs to be involved in data collection. There's a lot of standards around, for instance, collecting data from Native American populations, and you have to have involvement from those communities at that point. So having the conversations about that sensitive data specifically in advance is super critical.
Wonderful. Thank you to our panelists for all your great insight. I believe we got to pretty much all the questions that were in the Easy Retro. So I think I'm just going to give you a few pointers and information before we leave today and we wrap up our webinar series. So there are a couple opportunities that I wanted to tell you about that are team science related. One of them is UNC Chapel Hill is going to have Research Week, which is next week, October 21st through 25th. And that's going to feature a presentation from this ACTS team on collaborative team writing in the science-based research collaborations. And that'll be on Thursday, October 24th at 2 p.m. Eastern. So this is a little bit different time than our normal webinar series, but it's still on a Thursday. So please watch for this event. This is certainly open to the public, so you're all welcome to attend. And we can put a link to that in the chat, and we'll also send that out. Our next ACTS webinar is going to be held Thursday, November 21st, and that's going to feature several of our past experts in the science of team science field and team science practice, answering some previously asked questions from our webinars and presentations, as well as fielding some new questions that we either didn't get to or that you can address by adding in that when you register for that webinar. So that's going to give you an opportunity really to learn about everything you've ever wanted to know. So if you have a question about team science broadly or specifically, please join us in November for this unique event called Team Science in Sync. The experts explain it all. So as always, we'll be sending out a link to today's slides. So you're going to have this information via email in just a few days. And if you haven't already signed up, please join our listserv so that you can stay up to date on our news and events from the ACTS program. And also please take time to look at previous ACTS webinars because we have them all posted on our YouTube playlist. So thank you again so much for joining. I hope you had a wonderful time. I know I learned a lot, and it was great to hear from our panelists. So thanks again to our wonderful panelists, and I hope you all have a wonderful day. Thanks all.
Thanks, everyone.